When that's on, you're on.
Okay.
Okay?
The red light is on?
Yeah.
Okay.
Good afternoon. I'm being a little tardy myself. I didn't realize it. Sorry about that. We're going to call the Health and Social Services Committee to order. Madam Clerk, will you please do roll call, please?
Amobian,
Present.
Davis, Somerville,
Here.
Boys,
Here.
and Garrett.
Present.
All committee members are present.
Members are present. Thank you very much. I know this is our first meeting of the year. Do we have any past minutes that we need to approve?
You do from last
Okay.
year, yes.
May I have a motion to accept the minutes from the last meeting, please? May I have a motion? Are you on the committee?
Can we?
Okay.
Okay.
Is someone second it?
A second.
Second.
Second
Okay.
motion.
It's been moved and seconded, and minutes are passed as written. We have invited the executive leadership team from SUMA, and we thank them for coming. It's basically an opportunity to educate us as to what the next steps are for our local hospital, and we thank you for coming. I can't imagine what you're going through, but hopefully you can share enough with us to, and we do have some questions, I know you do, you know that. I think I'm going to turn it over to Ms. Tracy Carter, who's going to introduce our leader at this time, and the mayor will come after that. Is that okay? Sure.
Good afternoon, Chairwoman Amobian. My name is Tracy Carter, and I serve as System Director of Government Relations and Health Policy for SUMA Health. I have 29 years of service with the system. I want to express sincere appreciation to you and the Health and Social Services Committee members, Councilwoman Boyce, Councilwoman Davis, Councilman Garrett, and Council President Somerville for providing us an opportunity to further educate Council about a decision SUMA's Board of Trustees made to best protect SUMA's mission of providing the highest quality compassionate care to patients and members and contributing to a healthier community. Today, you will hear from Ben Sutton, Executive Vice President and Chief Operating Officer for our health system. He has been with SUMA for 18 years and has helped position the organization for success within a highly dynamic economic environment. Mr. Sutton will spend approximately 10 to 12 minutes discussing what's happening with the healthcare sector and why the HATCO decision represents the greatest opportunity to stabilize and expand the SUMA system while benefiting the Akron community. After his remarks, Mr. Sutton will welcome questions from the Council Committee. If committee members have questions regarding our due diligence or regulatory process thereafter, Rob Gerberry, Senior Vice President and Chief Legal Officer for SUMA Health, will address the committee. Mr. Gerberry has been with the system for 22 years. And with that, I yield the floor to Mr. Sutton.
Thank you, Tracy. And thank you, members of the committee, for allowing me some time today to discuss this incredible opportunity for SUMA, our employees, our medical staff, and most importantly, our patients and this community. Thank you, Mayor Malik, as well, for your ongoing support of SUMA and the vision you've brought for Akron's future. SUMA takes its responsibility to Akron and its role in the future of our region extremely seriously, not only as a provider of safety net health care, but also as a major employer and economic engine for our region. I had a chance to watch the recording of Councilman Hardy's statement from last week, and at SUMA, we appreciate his commitment to the Akron community and share in his passion to improve health care. The scenarios that he described for patients are all too common in our industry today. For every amazing story of healing, compassion, and extraordinary dedication by providers, there are examples of unacceptable wait times, seemingly exorbitant pricing, and largely unmet community needs. We could spend our entire time this afternoon on the state of the industry and its challenges, but let me sum it up by saying the following. Healthcare in the U.S., as well as here locally, is not affordable. It is not easily accessible. It is not distributed equitably, and it has not achieved the efficiencies or consumer empowerment that come in a more fully digitally enabled industry. Our board, which has representation from the Akron community, felt strongly that to go it alone and do the same things wouldn't address these issues or create a different outcome. Neither would a traditional not-for-profit merger. The entire hospital industry is struggling. Combining two inefficient companies in an inefficient industry does little to drive change. We're seeing incredibly large health systems that already consolidated now look for bigger consolidations, chasing those efficiencies of scale without making fundamental changes to a model of healthcare that isn't working for our country. The same issue would hold true in pursuing more public support via a levy, for example, as has been suggested. Adding incremental taxes only makes an already expensive thing more expensive for our citizens and does nothing to address the underlying problems. It's also not enough. Just being practical, a $50 million levy would be significant for taxpayers, but it would be insignificant in terms of the long-term sustainability of a $2 billion health system. We've put in place over $130 million of performance improvement initiatives over the past 2 years alone, just to maybe get back to break-even performance. We have to address the fundamental issues I described if we want SUMA to be here for generations to come. The new relationship that SUMA announced with Health Assurance Transformation Corporation, or HATCO for short, is designed to address these challenges head-on, making SUMA and Akron a model for what is possible in healthcare when you challenge the current norms and take down the artificial barriers to integration created by tax status and align the resources and incentives of community-based healthcare, investment and capital, and technologists and innovators. This model is unique. It's new, and it hasn't been done before, and we're just at the beginning stages of it. I recognize that leaves a lot of room for speculation and misunderstanding, so I want to make sure that I address directly some of the terminology that's being used that really doesn't apply to what we're doing. The first is the question of venture capital or private equity in healthcare. This type of investing certainly has its place, but I know that many don't believe it should be involved in healthcare. I don't want to engage much in that debate because the reality is that this is not that. HATCO has been founded by General Catalyst, which is a venture capital firm, but HATCO is neither a venture fund nor a typical PE investment. Those types of investment vehicles have return requirements that are too high and time horizons that are too short for healthcare transformation. Their focus is typically quarters to years, where ours is years to decades. To account for this, HATCO has been structured as a permanent investment with expectations of moderate returns typical of high-quality, well-functioning health systems. there is a clear recognition on the part of General Catalyst and HATCO that this transformation will take time and their long-term commitment to our community is real. I've also heard that SUMA and its employees and patients are going to be guinea pigs for these venture capitalists. We've also been referred to as maybe a test kitchen. I like the test kitchen one better than the guinea pigs. I understand the concern. It was recognized early in this process by our board and carefully guarded against. Healthcare isn't the place for rapid adoption of untested technologies. It would be detrimental to quality of care and to the workload of our employees. Not only are there no intentions to do so, this partnership is structured with aligned incentives to avoid that scenario. For HATCO to be successful, SUMA needs to become a model for healthcare transformation that is disseminated to others across the country and potentially the globe. Lower quality and disaffected employees is not a replicable model. We will adopt new technologies that will remove barriers for patients and reduce friction for providers. But these will initially be mature technologies, and eventually we'll be working together with HATCO to create new solutions to the problems of the future. Lastly, we need to address the concern about a for-profit health system. Healthcare systems are large, complex corporations. Regardless of their tax status, they have to make a profit. For us to keep up with inflation, to reinvest in raises for employees, to build behavioral health centers that our community needs, we have to make a profit. There are two ways to do that. One is grow, and the other is cut. If we do nothing, the cuts are inevitable. People lose jobs, services get cut back. None of that is good for the health of our community. Our ability to grow to create sustainable levels of profitability and long-term viability for our health system is limited by our ability to invest. The pandemic and the rough financial years for our industry that have followed have significantly cut into cash reserves. SUMA is better off than most. We're relatively stable and have a comparatively strong balance sheet. But we spend over 25% less on capital annually than we should to keep up with our depreciation. We don't have the financial strength to invest in the social determinants of health outside the four walls of our system, and we definitely don't have the capacity to invest in transformation. Borrowing more, even if possible, would only add to the problem. Regardless of our tax status, we have to be profitable to remain viable and best serve our community for the next 100 years. We should not confuse tax status with commitment to a mission. And this relationship gives us the resources we need to continue to make the investments in local healthcare our mission demands and our community needs. That's why we're so excited about this acquisition. It's going to mean investment in SUMA, investment into value-based care delivery, investment in Akron and the surrounding communities, and a way to turn the trajectory of the organization toward generational sustainability, to thrive rather than just survive in a future model of healthcare. There are three components to that investment. First, it will create a significant community-based foundation that will be able to deploy millions of dollars to focus on addressing the social determinants of health in a way that health systems are typically unable to do in a systemic way today. Second, it will invest in healthcare for our community while carrying forward the charity care policy and mission of SUMA to serve all. The strategic capital that is part of this investment will help to create access, expand critical population health-based services, invest in lower-cost care options and settings, and bring technologies that make care easier for providers and enable patients to engage with the health system in ways they're used to engaging with other industries. Third, it will significantly enhance the amount SUMA is able to invest annually in routine capital so that we keep up with the ongoing needs of our local facilities and innovative care modalities that this community depends on. Yes, SUMA will have a new owner in HATCO, but in addition to the fact that HATCO is led by top-tier talent from very successful not-for-profit health systems, the unique design of this transaction keeps the leadership team of SUMA local, keeps representation from local community members on the new SUMA board, and keeps our headquarters in Akron. And if we're successful at being a model for transformation, it likely brings new headquarters to Akron from companies that come out of or want to be a part of that transformation. That brings jobs, and that brings economic development to a region that needs it. That's a lot different from other options that potentially move the headquarters, change out leadership, reduce the voice of the local community, and gain efficiencies through reductions in force and program consolidation. We don't want that future for our patients, our employees, or our region. This really is a once-in-a-lifetime opportunity, not just for SUMA, but for Akron and its people. It's our opportunity for our community to lead the change that is needed for healthcare and be resourced to do so. I will leave you with this. HATCO isn't investing in SUMA because it can make a quick profit. Quite frankly, there are easier ways to get a fast return on investment than buying a health system. They're investing in us because of who we are. It's because we've maintained an integrated model with a health plan. It's because we are committed to serve our whole community in a value-based way. It's because we have the courage and readiness to seek change for the better. And it's because of the impact that change can have on this region. That's the transformation they're investing in. They aren't here to change who we are and what we do. They're here because of it. And we collectively believe that with the right structure, the right vision, the right investment, and the right people, we can build a profitable and sustainable business model that is there for the next generation, while also doing better by the people we serve and truly fulfilling our mission to contribute to a healthier community. Thank you.
Thank you very much. I've invited the mayor to come and make a statement. And Mr. Mayor, you just at this time.
Good afternoon, Madam President, Madam Chair, members of council, members of the SUMA team, and I want to thank all of our community members who are here with us today. Particularly want to recognize Mayor Judge of Barberton. Appreciate you being here today, sir. And also your presence is a reminder that SUMA is a pillar of the Akron community, but is also a pillar of many of our local communities, and that we're all bound together. So really appreciate you being here, sir. So as I mentioned, SUMA is a critical community institution. Right? That's true as one of our largest employers. That's true as a place that many of us and members of our family go for care when we need it. Right? And this needs to be an institution that we can continue to rely on for care for decades on into the future. I think we all share that goal. And in the last week or so, since this news has been made public, there have been a lot of concerns raised. When the news was shared with me, I had a number of questions, and I appreciate the opportunity to address them. And I think that as we go forward, I want to be clear that concerns and questions are entirely fair and reasonable. Well, as I said, I have them myself. I think one of the biggest questions, as I've thought about it, is that what is being offered sounds very promising. At the same time, how can an entity make a commitment that they can commit that level of capital for decades, right? We can all hope that that would be the commitment, but such a large amount of money over such a long period of time, it's something that our institution would have trouble doing, right? Any institution. And so that is one of the biggest things that I've pondered. I'm eager to learn more, and so I appreciate the SUMA team being up front and being here. I hope that we continue to have these conversations like the one we're having today and have them with the public as well. I'm going to have the chance to meet Dr. Harrison from HATCO on Thursday and look forward to that conversation and talking about some of these specific commitments. I'm also hoping that he'll have the chance to meet with President Somerville soon and also have those conversations and soon with the entire community. Another thing that I wanted to mention, in these reflections that I've trying to have on this topic, one quote has stuck out to me from President Biden. He frequently says, "Don't judge me against the Almighty, judge me against the alternative." And I think that's something we all have to consider. I think we all know that healthcare is broken in this country, that we need deep systemic changes to how healthcare runs. I think the question is, what is the best choice for SUMA going forward? Dr. Shriver, my friend and my classmate, is here in the audience. He's written an article about the idea of there being a county-based model like Metro Health. Other folks have shared, and we've certainly seen the transition that Cleveland Clinic Akron General went through a number of years ago. SUMA is an institution for all of the positive things, and I think we had a a contract come before council last week about helping us out with getting our EMS medics trained. So there's examples of partnerships like that every week here. But for all the positive things, SUMA has been in difficult financial status for a long time. And so, again, I would urge folks to kind of go back to that quote, don't judge me by the Almighty, judge us against the alternative. With all that being said, I think we have to go back to this principle of making sure we have a permanent, long-term, sustainable, healthy SUMA, both from a patient care level, but from an employee level going forward in this community. So that's going to be my goal. I think that's something we all share. So welcome the conversation and hope, again, that it's the first of many conversations that we have.
Thank you, Mr. Mayor. I would like to start. I want you to know that we certainly appreciate you being here, and I guess we all have all kinds of thoughts as we heard the news. I did my own little personal survey of people that I came in contact with. I have worked in the healthcare field for more than 40 years now. I know I don't look it, but I have. And I've been in behavioral health. And we work very closely with SUMA, Akron General, North Coast, the state hospital system, and you've been very good partners. I've been to your hospital many times, not too many, but many times, and gotten excellent service. I guess my real concern and question, as I listened to Mr. Hardy talk about his own family issues over the years, as a community, when we look at the hospital, we see these beautiful big buildings with all these names on them, and I'm assuming that these philanthropists have just donated money to help SUMA out. I'm just curious, how do you balance that kind of vision against what we are hearing today about all of the debt that SUMA is in and has been in? And you can imagine the little survey that I did amongst the people that I talked with, nothing was positive from them. A lot of people don't see anything positive with a healthcare industry going into the for-profit domain. And I've heard your statement. So could you just talk about those two things off the top of your head, please?
Sure, happy to. I like your quote about judging against the alternative, and I think that's part of what we're dealing with today is, if you do that same kind of informal poll of people, lots of people have had really negative experiences with the healthcare system recently too, right? And through COVID, access has been a challenge, and now post-COVID, staffing has been a challenge, capacity has been a challenge. We have a lot of people waiting a lot of hours sometimes, depending on the day of the week or the time of day you come to the ED, or whether or not we have a bed available, particularly in behavioral health. We run into that a lot, where despite the fact that we added incremental capacity, we're still full a lot of the times, and so people are waiting. So the question is, what are we going to do about that in the future? And that's really what this partnership is about the future in some way, and how do we make sure that we have the capacity to invest in future healthcare capabilities and aren't as dependent upon the current set of healthcare capabilities into the future. There's a reality that in the future there's going to be more you can do at home. There's already more you can do from your phone and from your watch. A lot of that stuff isn't integrated into the healthcare system in the way that it needs to be today, because individual providers like SUMA lack the ability to invest in doing that work or standing up that model at scale. This is a way to get access to that technology at a scale that an independent $2 billion health system wouldn't be able to otherwise. So that's part of what we're thinking about as it relates to why to do this transaction, and I understand the concern about the for-profit aspect sometimes being viewed as negative, but this is a different model than what people are used to in for-profit healthcare. It's a different model than what would be typically a private equity investment. Typical private equity investments in healthcare have gone something like this. You invest a bunch of money, you maybe load it up with debt, you cut costs, you reduce staff, you quite frankly make things worse from a quality perspective, but you make things a little bit better from a financial bottom line perspective, and then you flip it. And that's what you do in healthcare, in healthcare private equity. That's a 3-year proposition. This isn't a 3-year proposition. It's not structured that way, and it's not structured as a private equity fund specifically to avoid that type of future. This is structured separately from General Catalyst venture capital funds. and it's structured as a permanent vehicle, not a fund with time horizons or investors that need out at a certain period of time or with a return on investment that isn't suitable for healthcare.
When you talked about the investment in social determinants of health, give us an example of what you're talking about doing
Yeah.
that will improve the system.
Sure. So ultimately, that will be a sort of separate community-based foundation, so it won't be us that's doing it, but let me give you an example. So there's trade-offs, right? Like you mentioned, the people investing dollars in SUMA today with names on buildings and supporting us from a philanthropic perspective. That part will go away, right? That's one of the trade-offs of this. Just being realistic, as a for-profit entity, you can't have a dedicated foundation tied to you. So we're not going to change the names on the buildings, but future investment in SUMA won't be able to come from philanthropic sources. What we gain, though, is what will be a very, very large foundation dedicated to doing the things that, quite frankly, we wish we could do and can't invest in today as it relates to social determinants of health. So think about transportation, think about food insecurities, think about housing conditions, things that we know impact health of our communities, but that SUMA independently isn't able to invest in, right? The size of our foundation or the dollars that we can potentially spend on this is relatively small compared to what this future foundation is going to be and the ability that it will have to impact those things in the community. So yes, we'll lose some philanthropic support, but if we're, if you're a SUMA Care member or you're in a value-based contract for SUMA and you're taking better care of yourselves because this vehicle is now helping to invest in social determinants of health, we're going to benefit from that as a health system. So we lose a little bit on the direct foundation support, but we gain a lot on what will be a healthier community because of the investment of those philanthropic dollars in those kinds of resources.
We're going to go with the committee first. Are there committee members with questions? Ms. Davis?
Hi, and thank you all for coming. A 2023 study from Columbia University Mailman School of Public Health found that when you merge with a capital venturelist, it's associated with higher patient and payer costs and may decrease the quality of care. And also, I looked at Crane's business report and Dr. J.B. Silvers, I'm sure you're familiar with him, that Hackle's strategy is just to use SUMA as a test case. And I believe it was published in the Crane business report that $200 billion has been infused into the market through venture capitalists. Can you guys speak to that?
I can't speak to the last part about the $200 billion, but the research that has been done around private equity in healthcare has been done on sort of two things that are different from what we're talking about. Many of those hospitals are distressed, and to be candid, they tended to be of lower quality and were distressed, and they were part of a transaction like the one I just described, where they're essentially short-term investment vehicles. They aren't intended for long-term investment, and the kinds of resources aren't brought into the community. They're essentially pulled out. They strip down the health systems, they cut costs, they cut staff, and they get it to a point where it's profitable, and then they sell it, right? So you invest and make a return. That's the type of private equity that has existed in healthcare, in hospital transactions historically. Not all private equity is bad in healthcare. You know, we have seen it have a positive benefit where it brings resources. So there are a lot of primary care groups, for example, that are with for-profit partners that bring resources in to those partnerships and invest in support functions that help them deliver and provide better value-based care. That kind of model where resources are being brought in is what we're talking about here, as opposed to resources being stripped out. So I understand the research, I've read it, but it is a very different set of health systems that they're studying than the transaction that we're talking about here, or SUMA, who's already, quite frankly, a very high-quality hospital. So we have recently been recognized as one of the top 50 hospitals in the country. So this isn't a low-quality system that they're buying into and trying to flip. This is a permanent investment for a long period of time in high-quality health care.
Thank you.
Yep. Chair.
Thank you, Madam Chair. This may come across as pedestrian, but I do not know the financing part of healthcare that well. But what does General Catalyst or HATCO have to gain from this type of structure? Because in a short-term structure, flipping it, that's just quick financial gains. By playing this long game, like, help me understand what they're getting. Is that just building a balance sheet to do other investments? Explain that a little bit.
Yeah, I think two things. Number one, I think you have a group of individuals, both at General Catalyst and at HATCO, who truly do believe in this concept of health assurance that they've proposed and the transformation that can be possible in healthcare. Part of that stems from some of their prior investments and experience in what they would call point solutions. So General Catalyst has invested in a number of healthcare IT platforms and other companies that they've been able to make a profit on and be successful with, but they haven't done as much as they would like to actually transform healthcare in a systemic way. And part of the work with HATCO and the reason for HATCO's existence is the idea to take those capabilities and bring them together with a community-based healthcare provider to integrate that so that it isn't just investment and innovation for the sake of innovation, it's actually integrated with healthcare delivery. So they stand to benefit potentially in two ways if that transformation happens, right? One is, if SUMA is successful at turning itself around, it will generate a modest return for people. It's not going to be the type of return that they typically get in venture capital, but it is, if you can generate a sustainable, reasonable return that is attractive to certain investors that have a longer term time horizon and want more stability in the investment. The second is, if there are companies that are involved in that transformation or companies that come out of the transformation as we solve new problems in the future, then General Catalyst has the opportunity to invest in those and help get those to market, which will benefit them over time as well. So having the transformation here be successful, having it actually benefit the community and drive systemic change in healthcare is something then that they can sell to others as an example, whether it's through those companies or through consulting services or other things where other communities want to see transformation like we would see in Akron.
Are there other members of the committee?
Madam Chair?
Oh, I'm sorry. I forget that you're part of the committee temporarily.
Yeah,
Madam
me
President.
too, me too.
Go ahead.
Thank you, Madam Chair. I just want to thank SUMA team for being here and sharing this information with us. And I do have a lot of questions, but I do know your team has done a due diligence and you really do believe this is the best option moving forward. And so I really want to talk about the community-based foundation, right? And, how the community will benefit. Really want to make sure that there's going to be community stakeholders, right, that have a seat at the table, right, to say how the foundation is going to be set up and how those funds will be spent. Can you talk a little bit about that?
Madam President, if I could invite our legal counsel, Rob, to the table, so he and the Chief Operating Officer can tag team on the structure and the point of assuring that community leadership and input is involved with the structure of the new foundation. You want to start, Ben, and then let Rob?
I just wanted to say, if you want to speak, you can speak here or from that podium there. Go ahead.
So, Rob, I'll start and you can go. I think a lot of that is to be developed. Where we're at right now, sort of post-LOI, pre-definitive agreement, letter of intent, pre-definitive agreement, we have the framework established for the fact that there will be a community foundation, and we all agree on the concept that focusing it on social determinants of health is the thing that will benefit the community most. If you think about what would be remaining in terms of a healthcare transaction, we should focus that on healthcare, right, and the things that will benefit a broad section of the community from a healthcare perspective. Its specific charter to be written, and also there's a regulatory process that we have to go through with the Attorney General to get that approved as well. And so there'll be a framework put together for that, and I think a lot of opportunity. We will use our boards and committee structures to help do that. Our current foundation will be a part of that discussion, which has a lot of community representation on it, as well as our Community Engagement Committee. And I think there's going to be more to come on the development of that, but Rob, you comment as well.
Sure, piggybacking on what Ben said, we are at that preliminary phase right now of where we're saying, now that the public announcements occurred, we will leverage the resources we have, not only our parent board of directors, but our Community Engagement Committee, which has several of our local agencies represented to get their feedback, and then take that out to the broader community. From a regulatory perspective, SUMA doesn't get to decide ultimately how this looks. We go to the Ohio Attorney General, and we submit to them what a proposed charter could look like. They give us feedback not only on board membership, things that they want to see in the charter to make sure our communities are best represented.
I'm sorry.
Thank you, Madam Chair. Couple questions as it relates to the employees. With you guys being one of the larger employers, how have you guys engaged the employees there? And then also, what are some of the, is there another model that HACO and SUMA, is there another model who's done this already? And then if so, what were some of the pros from that? And if so, what are some of the cons from that? And what do you guys plan to do to address those to make sure that Akron is super successful? Thank you.
No one else has done this. So I'd love to give you pros and cons, but there aren't any. And that's an incredible, and we get that question almost every time we present. And I understand it because people want to sort of tie it to something and say, is this like that or something else? There are other examples of private equity in healthcare, but we specifically don't want to be that. There are other examples of healthcare mergers, but that largely hasn't driven value for the healthcare industry or for local communities. So we're doing something completely different. And so there isn't a template for it or a framework for it. And the nice thing about it, though, is we get to develop that. There isn't a model that they're bringing in and saying, this is exactly what you're going to do. We're going to develop that with them, with local leadership, with leadership from SUMA and the board to help to do that. So there just isn't a model. As it relates to the employees, we have, since we made the announcement, we've done 15 or 16 town halls with our employees, all different kinds of venues, virtual, in person. We've had about 3,000 people from SUMA participate in those. More to come. We're going to continue to do those. And Dr. Devaney, myself, other members of our leadership team are going to lots of individual venues now, department meetings. Before I came over this morning, I had one with all of our service lines. We're sort of making the rounds to make sure we're available to answer questions and engage people in understanding it. And then over the next 4 or 5 months, we're going to start the work around what we call transformation planning with HACO, which is the planning for the future, right? So once we get through some of the due diligence work and some of the legal and regulatory work, creating the agreements, then there's the opportunity to start really planning together for the future and how are we going to leverage those resources. And that's an opportunity for employees and leaders at SUMA to get engaged again in helping to think through what are the challenges they face today and where could resources or solutions potentially be applied to help make things easier.
A follow-up question, too. A lot of times when new mergers or business ventures come together, they focus in on the SWOT, the strengths, the weakness, the opportunities, and threats. Have you had a chance to really just go through that? What will be the strengths, the weaknesses, and opportunities and threats that you see?
Yeah. That's a 4-part question. All right. So strengths are what I think I just talked about. I think, one, there's resources, right? Resources that are going to be brought to bear and access to capabilities as part of that resource. So it isn't just financial, it's capability-based as well. So that's number one. And number two, I think, is the opportunity to actually participate in the development and the leadership of this for our community, that this isn't a group that has, for a health system merger, typically the system that you're merging into, they got a way of doing things, right? That isn't built around sort of the local culture or the local community, and you follow that template. It's just a reality of these kinds of transactions. There isn't anything here. We're building it together with them. And so we have a common vision about what we want that future to look like, and we've got the resources to do it, and we're going to work together on it. So that, to me, is the strengths and what's most exciting about this opportunity. The weaknesses, as I just said, it hasn't been done before. There's a lot of risk and uncertainty in that, right? And that I think has some anxiety for people. And it's also, it's anxiety producing for our employees as well, who I understand would prefer more certainty, right? I think we all would. Judging against the alternatives, though, there's a level of uncertainty that exists, whether people recognize it or not, in doing nothing. And so that's the opportunity for us is to carve a different path and to be part of a future of healthcare that otherwise we would be significantly lagging on, not only at SUMA, but in the broader Akron region. And then I think the threats are, all of the threats that we face from a business and regulatory perspective all the time, right? The healthcare industry has, by and large, resisted transformation. It is an entrenched industry, and so we are going to encounter regulatory challenges, financial challenges, challenges from competitors who prefer to stay in a very entrenched model. And so doing something completely different that hasn't been done before in a very well-established industry, there's threats involved in that.
And then the last is a 5-part question. Thank you for answering my questions. Thank you.
Thank you so much for what you've given us. Let me just throw this out, then I'll open it up to the other council members. You've talked about some of the investments in social determinant of health area. I guess, as a person who's worked in mental health, I've just seen the pendulum swing too far sometimes. I mean, when they deinstitutionalized those hospitals and sent all of these patients to the community, it was reported that they were going to let the dollars follow the patients to the community, and we could develop community-based services for those individuals. You've talked about trying to do more in the community. You talked about transportation. You talked about food and all of that. Because if you do all of those things, you'll deploy more services outside of the hospital structure. And I guess hopefully, as you think about this, I hope you do some really deep thinking as to how do you do this? Because the work that we do as nonprofit providers, we collaborate with a lot of our partners and get things done. But when you're in a for-profit situation, sometimes, and I don't know if it happens all the time because I don't know your world, but there is not that tendency to share and to work together to get things done. I know that transportation continues to be a problem for many of the clients that we serve. Having them eat the proper food to get the proper nutrition, to stay healthy and all of that, it's a continuous issue and concern because you don't have the people in the house with them to help them develop those kinds of recipes and plans and so forth. Home care, people need that assistance as they leave the hospital to go home and those providers to help follow them. So those are a number of things that we have to think about when we think about transforming the healthcare system in that manner. And I hope that a lot of serious thinking will go into that because individuals who suffer from mental illness, they still die 25 years too early, and we know that.
Yeah, I completely agree with everything that you're saying. The reality is that the vast majority of healthcare happens outside of healthcare institutions, right? It isn't happening in a primary care office or in a specialist office or in the hospital. Those are short-term, point-in-time interactions, and most of healthcare happens the rest of the time, right? And so the future of healthcare, particularly value-based healthcare, is about integration and collaboration with resources well beyond the health system. No health system can do it alone, whether you're for-profit or not-for-profit. I know that that's the way that Sumo approaches the world today, and I know from my conversations with the HATCO team and the General Catalyst folks that they firmly believe it. And part of what they want to invest in is technologies that help to enable that in a meaningful way so that people can do more to manage their own care, and also that we can be better integrated from a technology perspective. I know Dr. Devaney and I meet with the ADM board leadership and the community mental health agency leadership like once a quarter, and one of the things we talk about most, other than transportation, is about data integration and the fact that we really can't talk to one another today, and we have lots of individuals who bounce from place to place, right? They go to this agency, they go to that agency, they end up in this hospital, that hospital. And that care isn't integrated or coordinated, and that doesn't get good outcomes. And so an opportunity as part of this is to think about how do we invest in things that help to enable that communication and that integration in a more meaningful way, because everyone will benefit, not only the patients, but the health system will benefit as well. The EDs are already too crowded, they don't need to be there. And if you're a SumaCare member, you're part of our insurance company, or you're in one of our value-based agreements, then the more that you get readmitted, we get penalized for that. And so it's one of those things where investing in those kinds of resources mean it's better care for patients, it's better for the health system, and ultimately it's more profitable, which means we get to continue to reinvest in other things that benefit people in the community. So there's a lot of synergies there if we are really open to that collaboration.
Thank you so much. I know that your time would be better spent if we could give you a solution to your problem as opposed to questioning your solution. But anyway, to the other council members who, Mr. Fusco, are there others that, I know, Mr. Fusco, you go ahead.
Yes, thank you, Madam Chair. The one question I have, and I understand the one piece about the long-term versus short-term in terms of the investor standpoint and the way they're viewing this, but excuse my naivete, but what's the difference between a nonprofit operation and a for-profit in terms of those that may not have the insurance, those that may not be able to afford, and that's one of the biggest things I see, the biggest things that people are approaching us about. What is the difference? And I know that's probably a federal mandate or rule or what have you, but what is the difference going to be for those of us that are less fortunate?
Yeah. One of the first things, when we started talking about this with our board, one of the first things they said, if you look at kind of our list of priorities for integration, at the top of the list is they have to adopt our charity care policy. There's no negotiating about it. It is in question. They have to continue to serve all people. And this isn't just a HATCO. This is any transaction that we've ever looked at historically. So they have agreed to adopt word for word the SUMA charity care policy and to continue to serve all payers and all members of our community.
What is the regulations federally on that? How does that work?
There are,
I understand that they're committed
yeah.
to that now, but down the road.
They're committed to that forever as part of this transaction. So there are federal regulations around, particularly around the ED. So if someone comes to the ED, you have to take care of them. Outside of that, there's not a lot of regulation around who you have to serve. And that's, part of the challenge in the community sometimes is, a group might take this payer or that payer, but not Medicaid or not all payers. And that gets to be a problem for access. So they have committed both to continue to see Medicare, Medicaid patients, as
Good.
well as to have our charity care policy.
Yeah. So, and this council just last year we had dealt with the relief in terms of debt based on folks that have and that's out of control as well as we find. So I think that's a lot of our concern here. Thank you for coming in, though.
Yeah, the commitment that they've made far exceeds any regulatory statute that's out there.
Are there other members of council who, Mr. Hardy?
Hi, friends.
Hello.
I've had a few SUMA clinicians reach out since the announcement. Can you speak to those that are currently in federal loan forgiveness and might need to work at a nonprofit or a community-based, and what we might be able to do for them?
Yep. So lots of conversation about that recently. And so for everyone's benefit, there are many, many federal student loan programs. The specific one at issue is the federal the public service loan forgiveness program, where if you work at a not-for-profit for a certain amount of time, you can have dollars forgiven. One of the challenges with that program is it's only for not-for-profits. And so as we move to a for-profit, you don't necessarily lose the history in terms of the years that you have spent in the program, but you wouldn't earn additional credit towards whatever time period was established for you to have forgiveness. What we've done over the past couple weeks is engage with a group to provide anyone at SUMA free of charge a sort of professional counseling session with people who are experts at all of these programs. These programs change all the time. There are actually new programs coming out this month that didn't exist a couple of months ago. And so there are a lot of options for people in terms of the federal repayment options. Some of them have forgiveness, some of them don't. There is no like-for-like, one-for-one replacement of the public service loan forgiveness program, but there are options for people. The challenge is everybody's situation is incredibly unique, and it depends on the kind of loans you have, the amount of loans you have, where you're at in that repayment cycle, as to whether or not some of the other alternatives look good to you or don't. And over the past week or so, as people have started to go through that program, I've talked to some who have said, this is going to be significantly worse for me. I've talked to others who said that the new programs that they looked at are actually going to save them money. and so people are happy about it. It's a very unique thing, and so we contracted with a group to make sure that everybody has an opportunity to meet with a professional who knows these things in and out, go through it in detail with them so that they at least understand where they're at and what their options are. And then if they choose to engage with that company, SUMA is going to pick up the fees for that, so that if people have a cost to switching from program to program, that sometimes there are those costs that we would make sure that we cover that cost. That's where we're at right now, and that's going to help us to get some more information about it as well and understand where people are at.
And Councilman Hardy, I'll just say that on the government relations side, we'll be having a conversation with our federal delegation to examine whether or not there is an opportunity to change the law to somehow consider our own employees, particularly given that they are working for a system that's maintaining certain essential services to help the women's health, the behavioral primary care population. So we will be exploring if law could be amended.
With the debt forgiveness for the nonprofit, was there a certain group of talent or pool that you guys were able to get because they had their debt forgiven that you're not going to get at this point in time, or how's that getting ready to look or work? Thank you.
It's a good question, and unfortunately, I don't know if I can answer it directly, only because this program isn't administered through SUMA, and so you apply for it on your own, so we wouldn't know. We don't have a good line of sight on who's in the program and who's not, because it's something that you handle on your own. I think the reality is that it's a relatively new program, relative in terms of long time horizon, and so people who are in that, if you graduated 5 to 7 years ago and you have student loan debt, you're probably, if you're working for a not-for-profit, you're probably considering participating in the program and filling out the paperwork to do so. And so we're doing two things to understand that. One is we're doing some, in our individual areas, certain groups that we know might be impacted, particularly younger clinicians. We're looking at that, or anyone who recently went back to school, we're looking at that to better understand the order of magnitude of it. We also did a survey this week where we're trying to gather some more information from people just to understand who's in the program and who's not, or who thinks they're in it. The other challenge with it is that you can bounce in and out of it, and so some people start in the program but then choose to do something else later. So it's not a fixed thing that you're definitely in. You can go in and out of the program.
Okay. One of the chiropractors that I ran across, she was so excited about the fact that finishing school and then going to work for SUMA to be able to have that debt relieved. I guess my concern, and perhaps maybe you answered it, but if there was like 80 people a year, now those 80 people aren't going to be able to come to SUMA. Have you guys thought through that? Is there a big deficit that you're getting ready to experience due to that? I guess that would maybe be your threats or weaknesses in that regard?
Yeah, that's what I said. That's what we're working on, better understanding.
Okay, Mr. Mayor has his hand up.
Thank you. Two takeaways or follow-ups that I had. The first is on the point about public sector loan forgiveness. As I've been thinking about this, I know that Council President mentioned, I think there is a lot of interest around what the scope of the foundation would be, and I would encourage us to think about the foundation not just as a way of benefiting community health, but as a way of providing support to employees in the sense that that is almost by definition providing community support in that these folks are members of our community. And particularly if there are ways to basically hold harmless employees from any negative repercussions that come from the changing of the financial status from for-profit to nonprofit, hope that, or rather the other way around, that that's something that potentially a foundation could provide support. I know that we're not sitting here writing the charter for the foundation here today. I just want to bookmark that. And then the second is, again, more of a comment that I think, I appreciate the point being made that this is distinct from traditional private equity. I guess, a question that I'll ask Dr. Harrison on Thursday, and I think going forward, is what ways can HATCO demonstrate that there is that long-term time horizon, right? Because certainly we all would like to state that, but I think that it would be helpful. And again, maybe there's a big round number that they can put on what their, capital portfolio is they're going to have to for their own investment. But I think those are the types of questions that we'll be asking to demonstrate, right? When Cleveland Clinic came in, there was a lot of hand-wringing around, whether that was going to negatively impact Akron General. I think we obviously knew that Cleveland Clinic had the bandwidth and had the capital to be able to do that. So I guess that's the general comment, right? Is we all as a community would like that reassurance.
I didn't hear a question, it's just a comment, I think. Are there other council members who would like to ask questions? Mr. Hannah?
I would just like to know, if you did not go into a merger, how long could SUMA survive without that?
Yeah, that's a great question. Maybe I'll draw a distinction between surviving and thriving in a way that we're all comfortable with. SUMA has we just finished the year from a financial perspective. We have about 170 days cash on hand, which is pretty strong from a hospital perspective. We've been as high as 250 days cash on hand, and that was kind of the depletion of some of those cash reserves that have happened over the past few years post-pandemic. Not-for-profit health systems can survive for a long time because of the not-for-profit status and the cash reserves that we have. It won't be a future that any of us like over the next 5 to 7 years. We have a budget this year that is to be break even, and that's after 2 years of $70+ million performance improvement plans each year. Those have been really difficult decisions to make around what do we keep and what are we not able to invest in. Today, our depreciation is about $70 million a year. A rough back-of-the-envelope estimate of how much you should invest in capital as compared to depreciation is 1 for 1. So our routine capital budget should be about $70 million a year. It's closer to $50 to $55 million a year because it's what we can afford. You get behind on those things over time, right, in terms of keeping up with new equipment, and that's before we even start to invest in new technologies, invest for growth, invest in emerging things that we want to make sure we bring to the community. So we're upside down on those things into the future. 5 to 7 years from now, we're looking at year over year over year, making those really difficult decisions about what we can continue to maintain and what we can't. Our benefit levels for employees aren't where we want them to be. Like, we have made cuts to some of our benefit programs to support keeping up with salaries and keeping up with investments, but we've had to cut back on things like our 403B match, our retirement match for employees. We're going to have to keep making those kinds of decisions where we cut this over here to make sure we fund this over here, and there's nothing about the industry or our market, unfortunately, because we are in a stagnant market in Northeast Ohio from a population perspective. So there's nothing about the industry that says prices are going to go up or there's suddenly going to be huge increases in terms of revenue, or from a growth perspective if we aren't investing in that growth. So I don't know if I can answer you in terms of how long we would truly survive, but I know that the next 5 years, 7 years, the trajectory is a negative one from a thriving perspective.
On that note, I thank you so very much. I can only tell you that there's another meeting in a few minutes. I know I told you that we started at 2:30. You have about 10, 15 minutes. We've been close to an hour. I only had one request from a community person to address the committee, and I want to give our former council person from Ward 5 an opportunity, hopefully to ask one or two of your questions that, because most of them I think have been asked, but go ahead, please.
Thank you, Chairwoman Amobian. And yes, Ben has done an excellent job answering most of my questions. As the former representative for Ward 5, I've represented this ward for a decade and have had a great, strong, cultivated relationship with SUMA. And so, having served this community for many years, I think it's crucial to address two of the concerns. I've sent them an email of these concerns as well. One of them is the impact on community health services. SUMA has played a vital role in addressing the healthcare needs in our community. Transitioning to a for-profit raises concerns about the potential impact on the range and quality of services, particularly those benefiting underserved populations. So if you could speak to that briefly, then I'll go to my second question, and I'll talk offline to you about the other ones.
Yep, happy to. And thank you for your ongoing support of SUMA over the years. It's been a great partnership working with you. You know, we see this as an opportunity to invest in resources for the community in a way that we wouldn't be able to otherwise. And so, you know, we truly believe that the things that we're going to be able to do in terms of bringing new services and new technologies that make access easier, that make patient care easier, is going to be significantly enhanced through this partnership. There's a real commitment on the part of the HATCO team and the General Catalyst team to want to have an impact on the community as part of the transformation. So they don't want to pull back on services that are ultimately going to be detrimental. They very much believe in this concept of serving the whole community, serving the whole population, and making sure that the services are there to do that. An example is the behavioral health hospital. One of the things that is attractive about SUMA for them is that we've made an investment in services like behavioral health, partially because we've made the investment and they don't have to do it, because we've already done it, but also because we've been ahead of the curve on that, and that we believe in this idea of integration of behavioral health services to serve the whole community and to serve the whole person. And a lot of health systems haven't made that investment and haven't made that commitment. And so the fact that we've done that and are willing to continue to do that is part of what they're attracted to.
All right, thank you for that. And then my other question is bond rating implications. The change in SUMA's health status from nonprofit to profit may affect its bond rating with agencies like Fitch. Considering my past role as the Secretary-Treasurer on the Akron, Bath, Copley Joint Township Hospital District, I'm concerned about the potential effects on the bond rating and the future of the financial stability of SUMA. So if you could.
That's a great question. This is a time of year when I start to worry about the bond ratings too, because we have to do the rating agency presentations coming up. This year aside, because the transition won't happen until next year. So this year we'll do our regular presentations to bond rating agencies. But in the future, we actually won't have the public debt. So the debt that we have, most of it is based on being a not-for-profit. And so as part of the transition, we would defease that debt and move forward with no debt in the new company. And that's part of the structure of this, is to bring an initial investment in that will help to eliminate all of that debt, and then the remaining amount of that will be what's available for the community foundation. So there won't be, the debt won't be rated in the same way. So we wouldn't have to worry about the rating agency impact.
Okay, thank you. Thank you. I'll talk to you offline about the rest of it. Thank you, Madam Chair.
Thank you. Thank you very much. Mayor Judge, the mayor reminded me that you have come to this body. We certainly want to give you an opportunity to either ask a question or make a comment.
Council and council leadership, SUMA leadership, and mayor. I came to get more information. I do have a meeting set up later this week with SUMA leadership. So more of a statement than a question at this time. But just like everyone else, looking at services, looking at employees, looking at not just each individual community, but the entire region, finances, the operational structure, service delivery, the patients, the tax implications, property, income. What is the expected outcome? What is a long-term reality for all communities? The existing partnerships, you kind of touched on that. Through our compact program, we have a nursing program through our 5-city compact. I believe SUMA has made job offers to every graduating person in the nursing part. The community investment. Those are the types of things that we will be looking at in Barberton, and I invite you to come to Barberton City Council to give the same presentation. In Barberton, the hospital is situated in a residential neighborhood. The big book kind of says that cannot work, but it has worked. I grew up in that neighborhood. I live in that neighborhood. I have been a part of or a witness to the changes that have happened to Barberton Citizens Hospital over the years. The perceptions, the fears, the anxiety that has happened with the changes in ownership. SUMA has been there for a number of years. They've been the stable owner and operator for years. They've been a great community partner. They've been a trusted partner, great services. Obviously, we want that to continue. So these are our, we live in a world where sometimes perception is greater than reality. So we want to make sure that we get the information out. This is a very difficult time. This is a confusing time. This is a time with high anxiety, a lot of changes, right? And I think we all know that change is going to happen at some point, at some level. So I appreciate the time. Just want to make some comments. I do have questions as we meet later this week, and then I will get with you to come to Barberton City Council. Thank you for the time.
You're more than welcome. And thank you very much. I assume that somebody could be available if council members who have ward meetings would like to have someone come out and educate their constituents. I'm sure that you would make yourselves or somebody
Please,
available.
yes,
to do
absolutely.
that. So thank you so very much. I hope we didn't take too much of your time, but we appreciate you coming.
We appreciate the time, and to the chairwoman, we do have copies of Mr. Sutton's remarks to share with the committee.
And we will give it to the clerk to give everyone. Thank you very much.
Thank you.
Thank you all.
Our next committee today is the Screening Committee meeting. Those committee members are Somerville, Fusco, Lombardo, Hardy, and Davis. We'll get started in just a moment here. Could the Screening Committee members please have their seats? Okay, we're ready to begin the screening committee meeting. Again, those committee members are Somerville, Fusco, Lombardo, Hardy, and Davis. All committee members are present whenever you're ready, Madam Chair.
Ask if we can please have a motion.
Do we need a roll call?
Somerville,
Here.
Fusco,
Aye.
Lombardo,
Aye.
Hardy,
Here.
and Davis. All committee members are present.
Thank you.
We're going to call the selection committee to order. Just going to ask if we can have a motion to go into executive session.
Yeah, I move to adjourn this committee into executive session in order to consider and deliberate on the appointment of an individual to fill the current vacancy for Ward 1 council person.
So we do have a motion on the floor. Is there a second? All in favor signify by saying aye.
Aye.
Any opposed? The ayes have it. At this time, the committee will move to conference number 1. Just going to ask if we can have a motion to come out of executive session.
Yeah, I'd like to make a motion that we go out of executive session and back into the selection committee.
Thank you. Is there a second? Second. All in favor signify by saying aye.
Aye.
Any opposed? The ayes have it. At this time, we will adjourn. The Selection Committee will make their announcement of who will fill the vacancy of Ward 1 at our 6:30 regular scheduled council meeting. Thank you.
Thank you, and we'll adjourn to go over the capital budget, the second review, in about 5 minutes.